Hi everybody, it's a time to introspect. It's a very important time to rethink, revisit some of the strategies that we have always looked at in medicine and healthcare. Today I'm going to present to you some of my concepts that I've developed over the number of years of practice, being in community health and also in clinical care. What I'd like to address today with this realization of COVID-19 that has swept the world and is also looking at sweeping India as well. But thanks to our Indian government, we're doing a lot of good stuff, and somehow or the other we've kept things in abeyance. There is a stronger resistance that we are all showing towards this COVID-19 in India. But here's a time for us to reflect upon what we have done so far. Has it worked? And what are the changes and strategies that we may need to adopt in terms of making things better for the upcoming future? If you look at this, I've drawn this. It's a very, very famous drawing on prevention by McKinley. And what I have all my life taught to students is this particular model. You may look at what have we created. We have created illness factories. Illness factories like habits, illness factories like lack of hygiene, so many habits. Drinking, smoking, fagging, drugging, so many things. But what's happening is people who are here on the illness factories using or abusing these substances or habits are landing down the stream. So they're falling into the stream and coming down and flowing through the stream. What we are doing right now in medicine, especially in this country, what we are doing is we have created 5-star hospital systems, no doubt about it. We have great ambulances, even with ICU care, ventilator care, all the support that are required. We have great NGOs which are working, star-studded, great amount of social work. And what's happening is we are capturing these people who have fallen down here downstream and bringing them into all of these things. And we are getting applauded and we get a lot of recognition. Great work. No reason to believe this is not required. But is this going to really solve our problem? And that's the fundamental question that all of us need to ask. When I look at it, the way I look at it is we need to move from repair, because all that's going to happen downstream is repair, repair, repair. If you look at Bangalore, go to any hospital, you will not find a bed. You will not get a bed. It is full. Why? Because we are constantly focusing downstream. Our entire focus is downstream. We are only believing in intervention, intervention, and intervention. This is not going to help going ahead. If we have to revisit and change something, we need to look at working upstream. And what is working upstream? Prevent people from falling here. That is the most important thing. Prevent people from falling so that the burden on these systems come down. And what we will then move is to better health, better life, better quality of life. And so we must now bother to say no to repair and yes to education and prevention. This is a model that we need to adopt. And I have a piece of information, or my thinking goes in this way to advise our Prime Minister, our parliamentarians, authorities who are sitting in positions of power who can actually make these decisions. And the most important thing is give more importance to community medical experts like community medical doctors, community dentists, social healthcare workers. These people in this country today have no say or very less say. They lack access to proper research. They lack access to proper funding. Their ideas are not really represented well. And this is the time, if we need to make this nation the greatest nation that it could be and which is on its path, we need to focus on this. Give more access to community experts. Give them more value. Invest in authentic Indian data and research. Allow people to actually do research in India. Open up the boundaries. Open up medical education. because every industry today has become global. Unfortunately, there is a very strong resistance in globalizing or opening up of Indian medical system. There is a huge need right now for us to open that up and learn, invest, and also promote Indian research. So create that. Because if you look at coronavirus right now, where is the information about coronavirus coming to us from? It is coming to us from the community medical experts. They are the ones who are going to guide clinicians. Unfortunately, we give a lot of importance to clinicians. It must be given, I'm not taking that away. But then, if we have to look at the larger part of our life and have to improve our health systems and really care about people and the community that we live in, then we should give equal or the same amount of importance even to community health experts. And that, I feel, is a lacunae right now. We're not investing too much on them. And the third thing is that it is very, very critical that we change the way medical education is being imparted. Right now it's more of theory and learning, and the whole system doesn't seem right. So we need to make it more applied. We need to make it more real life. We have to make it more problem solving approach. But right now it is more guided towards learning, studying, and then going back and writing down those as exams. We need to make it more practical, is what I feel. That will change the mindset of doctors. It will encourage young leaders in health and medicine to learn better and turn out to be better doctors. And then we need to allocate a separate budget to actually start a long-term program on healthcare disaster management. And I feel if we can develop a program, maybe a master's in it, and then start training young, energetic individuals who have that passion, who have that focus, and then we take the responsibility of training them. So we have a brigade of an army. We have a whole bunch of young, energetic doctors who are actually going to be focused about how to manage disaster. Right now, that's the biggest thing. None of us have knowledge about it. And COVID-19 today is showing this to the entire world. Because there are lack of medical professionals in China, in Europe, in any place that you think of. I don't think even the United States is able to handle if this is going to be an outbreak in the United States. So it's extremely important for us to learn from these lessons, not continue the same things that we have been doing, and not just look at how we are going to douse the fire right now and leave it and wait for the next fire to come. So it is very, very essential, very important that a strategic level thinking should be placed, and we all must invest our thought processes, involve people who have the right direction, who have the right sense, and make sure that we don't lose out on the long-term game in healthcare and healthcare planning. Thank you so much.